Good afternoon. My name is Justin Boutilier, and I am the Charles Ringrose Assistant Professor in the Department of Industrial and Systems Engineering at UW-Madison. Today I'm here to talk to you about a project titled Improving Tuberculosis Treatment Adherence Support, and this is joint work with two collaborators from MIT, Jonas Jonasson and Erez Yoeli. Tuberculosis is a global health crisis, and eliminating the pandemic is one of the United Nations 2030 Sustainable Development Goals. TB disproportionately impacts low and middle income countries where the majority of TB cases and deaths occur. We've had a treatment for TB for over 75 years, but treatment completion rates remain low, in part due to behavioral reasons associated with taking the treatment, including side effects, frequent clinic visits, and social stigmas. In this project, we collaborate with a mobile health startup in Kenya called Kahila that delivers treatment adherence support to patients on TB treatment. Kahila's platform is designed to measure adherence through patient self-verification, and if patients do not verify their treatment, they may receive automated reminder messages and further may receive personalized support sponsor outreach. The platform is designed to work on simple phones without data connectivity and is based on a host of behavioral principles used to design the messaging. Kahila was tested in an RCT in Nairobi, Kenya in 2016, where it was shown to significantly reduce the proportion of unsuccessful outcomes. In this project, based on the success of the platform, our goal is to develop an implementable policy for the personalization of treatment adherence support. And we do that by answering three questions. First, using data from the randomized controlled trial, can we estimate whether or not sponsor outreach improves engagement or patient verification on average? Can we identify patients who are at risk of ceasing verification or having a bad outcome? And finally, once we've identified those patients, can we understand whether sponsor outreach works even better for those who are identified as at risk? So first, we use data from the randomized controlled trial and an empirical approach to find and to estimate the average effect of sponsor outreach. And what we find is that sponsor outreach does improve engagement and increases the likelihood that a patient will adhere to their medication by roughly 35%. Second, we use data from patients' engagement with the platform as well as prior sponsor outreach instances to predict two things. One, is the patient at risk of ceasing their verification? And two, are they at risk of having a bad outcome? And using machine learning models, we're accurately able to predict both of these outcomes during the patient's time on the platform. And then finally, using these at-risk patients and the same empirical approach from before, we estimate the effect of sponsor outreach for patients who are not at risk, which is small but still effective, and for patients who are identified as being at risk, which has the largest impact on their likelihood of adhering to their medication. And so in summary, this project was focused on developing a personalized policy for treatment adherence support. We find that outreach improves engagement by up to 35%. Our models are able to accurately identify patients who are at risk of ceasing their verification. And finally, we find that sponsor outreach works best, up to 70% for patients who are identified as at risk by our machine learning models. Thank you for listening and enjoy the rest of the conference.